A very warm good afternoon to all the respected seniors. And first of all, I would like to thank AIOS for giving me this opportunity to present a rare case of 5 siblings with Waardenburg syndrome. Myself, Dr. PRAKASH Kumar KESHAV from JLNMCH, Bhagalpur. Disclosure, no financial interest. A 19-year-old female admitted in medicine department having complaint of pain abdomen and vomiting episodes. She has villous vomiting and heterochromia iridis since birth. On examination, she also had freckles over face and dental discoloration since birth. On local ocular examination, except heterochromia iridis, other ocular findings were normal. Her two elder sisters have blue eyes and black eyes respectively. Her younger sister, who died last year due to kidney failure, also had heterochromia iridis. And her elder brother have blue eyes like his father and grandfather and is completely deaf and mute. Her other extraocular findings were within normal limit. These are her slit lamp examination pictures. Now, Waardenburg syndrome is basically of 4 types. Type 1 is associated with PAX3 gene mutation. Type 2 is with MITF gene mutation. Type 3 is an extreme presentation of type 1, and type 4 Waardenburg syndrome is associated with Hirschsprung disease. It is also known as Shah-Waardenburg syndrome. It is associated with endothelin 3 gene mutation. All these forms show marked variability even within families, and at present it is not possible to predict the severity even when a mutation is detected. Now, diagnostic criteria for WS1 have been proposed by the Waardenburg Consortium. In brief, to be counted as affected, a person must have 2 major or 1 major plus 2 minor criteria. In major criteria, congenital sensory neural hearing loss and pigmentary disturbances like heterochromia iridium, partial or segmental heterochromia, hypoplastic blue eyes, and hair hypopigmentation like that is white forelock. Other major criteria are dystopia canthorium and affected first degree relatives. In minor criteria, congenital leukoderma, synorphis, broad and high nasal root, hypoplasia of Allen-Nazi, premature graying of hair is considered. For Waardenburg syndrome 2, in major criteria, there is exclusion of dystopia canthorium and inclusion of premature graying. And one major difference is that 2 major features should be present for the diagnosis of Waardenburg syndrome 2. Now, it is a rare auditory pigmentary syndrome caused by physical absence of melanocytes from the skin, hair, eyes, or the stria vascularis of the cochlea. Dominantly inherited examples with patchy depigmentation are usually labeled Waardenburg syndrome, like in our case among the 5 siblings. Severity of these siblings varies from completely normal to one dead with heterochromia iridium. So severity can't be predicted, but tendency can be commented, as case with heterochromia iridis has bad prognosis. The mechanism are less certain that how it occurs, but it appears that haploinsufficiency is a major factor in producing the relatively mild abnormalities of Waardenburg syndrome. Among heterozygous mutations, carriers may also be found, and Waardenburg syndrome 1 and 4 are now well-defined genetic entities, while the label Waardenburg syndrome 3 is largely redundant. Waardenburg syndrome 2 remains a heterogeneous mix. We can offer families an explanation of why they have Waardenburg syndrome, but we are still unable to predict what features of Waardenburg syndrome, what mutation are there, but we can't predict how will it appear. These are my references.